Thank you very much. I've just been introducing our speaker, Dr. Benedict Ekaidem. Dr. Benedict Ekaidem is a passionate obstetrician and gynecologist with over 2 decades of experience in medical practice. He obtained his medical degree from the University of Calabar, Nigeria in 2003, and subsequently proceeded to undergo his residency training in obstetrics and gynecology at the Lagos University Teaching Hospital, Lagos. On completion of residency, he obtained the Postgraduate Fellowship Awards of the West African College of Surgeons and the National Postgraduate Medical College in 2012. In addition, he holds a master's in reproductive medicine from the University of New South Wales. Through his extensive training in Nigeria and abroad, he has amassed a vast skill set and knowledge base in women's health. Apart from his work in general obs and gyns, most of his working life has been spent in his subspecialty interest area of reproductive medicine and infertility. He has pioneered the setup of fertility centers and helped many couples battling infertility achieve pregnancies and have children via assisted reproductive techniques and in vitro fertilization. He serves as a consultant and head of departments of OBGYN and women's health at the Federal Medical Center, Abuja, where he currently practices. Apart from active involvement in clinical work and research, he's actively involved in training and mentoring obs and gynae residents. He believes in continuous learning and sharing knowledge with his colleagues involved in women's health and has made clinical presentations at various conferences and fora. During his free time, when he's not busy attending to patients, he likes to exercise, play football, sing, read, and write. With a warm welcome and a round of applause in the chat, let's welcome Dr. Benedict Ekaidem to take us patient-centered care in maternal health. Yes, over to you, Dr. Benedict.
Thank you very much. And my deepest appreciations to the organizers of this program, to Project Aisha and MDOM for an opportunity to speak on this very important topic. I actually have nothing to declare. I will try to be introducing the topic, patient-centered care in maternal health, what it is, and we will try to go into the benefits and limitations of patient-centered care. We will touch on maternal health, different components of maternal health, and how we can integrate patient-centered care, from the practical standpoint. And we will make some recommendations and conclude. In the health of women during pregnancy, childbirth, and the postnatal period has, like we all do, continued to occupy the front burner of global health discourse for quite some decades now. The reason is not far-fetched because WHO constantly gives us figures, and these figures are not palatable figures. It's been said that in 2020 by WHO that about 800 women died from preventable causes of pregnancy and childbirth, and that amounted to about a woman or 2 women dying every minute. And yes, it's true that some progress has been recorded in the past decades as well. Especially WHO also talked about between 2000 and 2020 that there's been a drop in maternal mortality ratio by about 34%. While this is good news, but unfortunate situation is that the mortality figures are still unacceptably high. And it's also interesting to note that also, unfortunately, that most of these figures, about 95% of these deaths, are happening in low and medium income countries, where those of us, I'm sure majority of us listening to this presentation are listening from. It is on these that we cannot, the world cannot continue to be silent, especially when it comes to strategies and whatever models can influence, the quality of care that is given to women when they're pregnant and trying to give birth. According to the United States Institute of Medicine, when talking about quality of maternal care, there are 6 things that people, that they say we should be concerned about. These 6 components and elements include safety of care, effectiveness, patient-centeredness, how timely, how efficient, and how equitable this care is. And some of these aspects are actually what the world is looking at now, but of interest to us today will be the aspect of patient-centeredness. Patient-centered care, interestingly, has risen to the top of global discourse on maternal health due to, of course, several reports that also have been documented of how women's health is unfortunately not optimal in terms of the reports of abuse and disrespect and neglect of women during childbirth. There is ample evidence also to show that the mistreatment of women, associated with poor outcomes in terms of whether they die or they suffer severe morbidity while trying to give birth. And before we proceed, I think it's important that we also say a few words on what has been found as the common reasons why women lose their lives. Number 1 on that list is hemorrhage, excessive bleeding. The other ones are hypertensive disorders, sepsis, unsafe abortion, obstructed labor, and also underlying conditions that may aggravate the woman's pregnancy. Some of these may include conditions like HIV infection, malaria, and the likes. Interestingly, all or most, at least, of these reasons why women die are either treatable or preventable if these women have access to high quality and respectful healthcare. So what is then patient-centered care? A quick look in the literature, one may come across several definitions. But I think the one that tends to dominate to a large extent, and I think would be the one given by the United States, and I quote patient-centered care as providing care that is respectful of and responsive to individual patients' preferences, needs, and values, and ensuring that the patient's values guide all clinical decisions. Yes, it would some care that is totally holistic. in nature and really, really centered on the patients and not necessarily on professionalism. Like some of us in healthcare practice across, we tend to have a very high biomedical approach to patients' care, where there is so much bureaucracy and stereotyped nature of looking at patients. And caregivers sometimes hardly have time to understand that the care of patients should be more about the patients themselves. In women's health, it's also very, very common to find, clinicians, healthcare workers, just tell women, you have this is what you have, prescription, take, go, do this, do that. And sometimes it's never really about the patients. It's probably about the doctor finishing his work, the nurse being able to sort out some things that bother more on biomedical approach. It was an American psychiatrist in the 70s that first, I want to believe, saw how these patients were generally being attended to. And he advocated for a new medical model where patients' subjective experiences were strongly considered. He was said to have criticized the dehumanization of medicine and disempowerment of patients. Judge Angel's advocacy actually did yield some good fruits, because later on, Western physicians adopted and developed what we today know as patient-centered care. And this was inspired by their daily practice, as this was seen to be a more comprehensive and holistic approach compared to the traditional biomedical approach to care. So patient-centered care thereafter, of course, gained impetus after the Institute of Medicine included it in as a dimension of quality of care, like I mentioned earlier. What are the benefits of patient-centered care? Like we've tried to preamble, patient-centered care actually places the patient at the center. It makes sure it is about the patients. It improves and enhances patients' autonomy. It improves continuity of care and integration of healthcare professionals collaborating on behalf of the patients. It doesn't stop there. It also empowers even the providers to plan and execute their work in ways that are much more responsive to patients' needs. It does this quite all right, but it's also seen that patient-centered care is not that easy. It has its own, what I would consider challenges. I would rather not look at those as limitations. What are the challenges that happen when one is trying to deploy patient-centeredness in care? Like we talked about it earlier, there is a lack of clear description of measurable behaviors. Sometimes you just say patient-centeredness. What does it mean? It means so much, especially when it has to do with how the patient perceives he's being cared for. Sometimes these things are difficult to measure. Also, as a challenge, is that there is need for more time and, of course, deployment of more human and material resources to the care of patients. It also, as a challenge, is the requirement that in order to be effective in patient-centeredness of care, there is a need for some structural changes at the organizational and practice level, which sometimes can be quite demanding, especially in practice settings like ours. So what are the requirements? What are the things that are really needed to have patient-centered care? The number one on that list would definitely be visionary leadership. The leadership must have a strategic vision. If you're the head of a place, whether it's a primary care center, secondary care center, private facility, or you leading in any space, to be able to have efficient patient-centeredness, you must first and foremost have the vision of what you want to achieve, in that facility. So the leadership must be clear in their vision towards patient-centeredness. Of course, the healthcare workers' buy-in is very important, as well as involvement of patients and families. And in addition, there has to be a systematic method where one can measure the quality of service, as well as a systematic way of getting feedbacks. The environment also has to be quality enough. And we cannot underrate the impact of supportive technology in this age of technological advancement. A few things may be in there and responsible for poor implementation. Some of these could include factors at the level of the healthcare workers. Generally, it's been documented that most workers, healthcare workers, do not really have proper training on what patient-centeredness in care would be. So if you're not really trained on how to communicate, how to relate, how to deal with patients' issues and make it holistic and about the patient, it's difficult to actually, ensure that you can render such service. The other thing is the shortage of staff. We all are aware of the JAPA syndrome. Everybody is stepping out. So when the facilities get depleted in terms of manpower, it can be difficult to say you are being effective in your patient-centeredness in care, because sometimes it may involve you having to give a particular caregiver to one patient for effective communication and all. So shortage of manpower is a major factor that could hinder implementation. There are also is structural and organizational issues within the health system. Now, like I said earlier, we all live and practice as healthcare workers in an environment where there is a very strong biomedical culture in terms of models of care. People look at healthcare as, a patient should not have access to a doctor that much. There's so much gap between the physician and the patient. There's so much that is confidential about the patient's case notes. Patients should not know what is written there. And that's very strong. But I think it's about time that caregivers begin to look a little away from such. So, what about we're looking at patient-centered care in maternal health care setting? What do we talk about? When we do that, what we actually talk about would be talking about patient-centered care against the backdrop of the three basic components of maternal health. What are these three basic components? It is care of the woman when she is pregnant, care of the woman when she's about to deliver, and care of the woman after she has delivered. So antenatal care, intrapartum care, and post-natal care are the components. So when you're doing patient-centered care, in a maternal care setting, these will involve all strategies and interventions that you deploy at each of these levels. What needs to be done when the woman is pregnant? What needs to be done when the woman is about to give birth? And what needs to be done when the woman has given birth? Traditionally, in women's health, we always look at from delivery to 6 weeks after. I came across a documentary of a certain hospital in Los Angeles called Cedars Sinai Maternity. It was interesting. They were talking about this as a hospital where a lot of celebrities go to give birth, the likes of Victoria Beckham, the likes of the celebrity musicians in the United States, Kim Kardashian. Most of these women give birth here. But when they were talking about what happens there, the fact that there is access 24/7 to a lot of facilities, you have a nurse by you, a doctor by you, everything is made available. It's pretty much just like you are in your own house in there. Yes, I was fascinated at the luxury and all of that. But beyond that, what struck me was the patient-centeredness in the approach to care. And it did occur to me that it doesn't necessarily have to be about the luxury, that what is being seen as that luxury could actually be deployed even in settings where there's not so much resources. And that takes me to what we should be looking at in terms of the basic principles. What are the basic principles that we can look at in terms of the model, in terms of modeling of patient-centered care? There is the principle as put up by Gracious et al. For PICA Institute. It had 7 domains. The first domain was the principle of respect for patients' values, preferences, and expressed needs, coordination and integration of care, information, communication, and education, physical comfort, emotional support and alleviation of fear and anxiety, involvement of friends and family, and the 7th, was transition and continuation. All of these actually express to a very large extent the different angles and different principles that will have to guide any center that is interested in deploying patient-centeredness, in the care of their patients. However, I must say, a much more practical approach is probably to look at all of these from 3 perspectives, and to look at it from the interpersonal perspective of care, look at it from the clinical perspective of care, and look at it from the structural perspective of care. From the interpersonal perspective or dimension, we can take an example. The examples under here would include communication, trying to know the patients, and of course, the importance of teamwork. In communication, it is important that we emphasize that listening is crucial. Whether it is you seeing that woman in the antenatal care, that woman, you must be able to listen to her. You must create that trust. That's where it comes from, that you are able to listen to her and her peculiar needs. Communication is at the center. And also embedded in communication is the fact that for effectiveness, sometimes there has to be the welcoming and participation of friends and family. Sometimes there could be language barriers, and the family and the friends will be there to be able to let you know and see where the patient is actually coming from. Also, from the interpersonal perspective is, like I talked about, the responsiveness that must be there from the entire care team. And not where a nurse or a doctor, a clinician sees the patient and the nurse actually doesn't know what next steps to take, or there was no proper togetherness, or the patient needs other caregivers. Maybe the patient has medical problems in addition to her pregnancy, and there is no involvement, and everybody's not working together. At the end of the day, you do have patients who are being seen by different doctors, and those different doctors are communicating different things altogether. So that is very crucial. The next way to look at it is the clinical dimension to it. It is very important that when one is looking at patient-centeredness, we must understand that they must understand the importance of clinical decision support. These actually should be made available. A lot of the times, the decisions that people make are just maybe routine practices or things that are not really backed by what is standard in terms of evidence. These days, when one is trying to engender patient-centered care, decisions on patient care must be centered on evidence, and not just evidence, but one has to be able to marry that evidence with patient's preferences. Very important. And as much as possible, get the patient involved in her care and management. And then the next aspect clinically is coordination and continuity of care. A patient can have a problem or is leaving a facility for another facility, and sometimes there's even no referral notes. Sometimes the patient just wanders about. There's no communication between the previous and the next caregiver. And sometimes some clinicians may see this as a sort of a disturbance or something. Just go there, they will attend to you there. All of these should not be. All of these should be managed a bit better. The same way too, clinical appointments. In patient-centeredness, it should be coordinated in such a way that the patient is communicated. Sometimes phone gadgets can be used, and these patients can actually have some visits that are virtual. It's totally about them. It is my visit and appointment to see you next. If there is a change, the patient should be communicated. So some of these, there should be apps that can be developed that can actually help, in such communications, whether that is phone call, emails. All of these can be deployed, to help, in foster better patient-centeredness and care in care. It's not going to only improve patient satisfaction, but it's going to reduce some of these very unfortunate abysmal statistics when it comes to, maternal mortality and morbidity. The third angle is to understand that the care patient receives from a facility is as good as some of the structural and organizational foundation and framework that is in place. The environment has to be conducive for patient-centeredness. It should be accommodating to not just even the patient, but to the clinicians and the needs of the patient's family. Simple things like having a health facility with clearly defined, signages for wayfinding directions for the patient to be able to navigate through the system. It sounds simple, but sometimes patients can come and really just float through the hospital of healthcare facility and really doesn't know what it's about. And sometimes in the process, complications may arise. The next is appointments, access to care. The appointment process, like I said earlier, should be made easy. And patient waiting time should be minimized. Sometimes patients are going through the system, the ordinary making payments becomes so cumbersome and so time wasting and very frustrating. And when this happens, the patient sees the health facility as not being good enough and even prefers some unconventional and unorthodox form of care, because in that place, they may not know what they're doing, but they sit these women down and they pamper them, they take care of them, they do all kinds of incantations, and they connect better with the patients, but they may end up killing the patients. So I think access to care really should be improved upon. Of course, like we talked about earlier, as part of the structural dimension to things is supportive technology. This is actually very important. It's possible to be able to track even patients' preferences these days. When you have a proper electronic medical record system and some apps developed, sometimes from time to time, you can put up a poll with patients actually talking about what they want. These can help and even provide self-management tools and information to these patients. So these are all the basic framework we've talked about, things from the interpersonal angle to the clinical and now the structural bit. When we look at all of these, we also should not forget that in maternal health, we would have to look at all of these when we're considering a woman that's pregnant. We'll look at all these three when we're considering a woman that is about to put to bed. And we consider all of these with the peculiarity of when a woman that has given birth already. So what can we say as maybe some practical examples of changes that we can institute in order to make a healthcare facility or patient-centered? Like I talked about, one is electronic medical records that can be used to track patients' preferences. Obviously, that's a structural dimension to it. We talked about wayfinding signs and maps, and we talked about smartphone applications that can help patients access their medical records. Gone are the days where we always say, write on the file, confidential, patients should not touch it and all that. That may not be as effective as we used to think. I think it's about time we started rethinking all of such approaches. Patients should have direct access. So making a patient have direct access to her consultant is part of a strategy that can foster patient-centeredness. Of course, like we talked about, the aspect of having regular patient-centered training for staff. You find some nurses, maybe some of our nurses are practicing in labor ward, they actually want to help. Maybe the woman is having delay in labor, baby is not coming, and you find some abusive things happening. A slap on the thigh. Madam, what's wrong? Verbal abuses. Are you okay? You want to kill your baby? A slap here, there, and all of that. Some of those things that are being done because some of these, our healthcare providers, are not trained. So one of the ways is training patients in proper patient-centeredness. I just believe that some of us maybe listening to these may actually go back and have a rethink in some of the ways that we look after patients. We can have regular surveys, like having regular surveys of patient experience, with feedback to the clinicians, can foster patient-centeredness. And of course, like we say, be able to reduce the dissatisfaction, and of course, all of the problems with mobility and mortality that can ensue from that. So we would have to say that making care more patient-centered can be quite challenging and complex, especially in settings with a strong biomedical culture like ours. But once there is a vision from leadership, and of course the collective will to do it, it can be done. It requires action at the level of individual patient-provider interaction, while concomitantly addressing structural and organizational problems within the health system. and perhaps more broadly, contributing to shape a social and cultural environment that will be more conducive to patient-centered care. So as part of recommendations 2, specific measures that may be considered may be training and educational support for healthcare providers, motivation of these healthcare providers to be able to render patient-centered care. Motivation can come in many forms. It could be financial, it could be by training and all of that. Investing in healthcare infrastructure is also a specific measure. Investing in electronic medical record system, investing in infrastructural upgrade for the facility, and building a patient-centered care-friendly sociocultural environment is also. Some of these are some of the ways that we can foster patient-centeredness in our environments so that we will be able to reduce the very high mortality and morbidity figures. So in conclusion, I would say that maternal health indices are still abysmal globally and perhaps much worse, or the figures emanating from low and medium income countries. This unfortunate scenario is preventable with access to quality care. So healthcare providers and policymakers must therefore turn attention to strategies and interventions that improve quality of care, and patient-centered care is increasingly being advocated. What does it take to achieve this? Focused leadership with strategic efforts aimed at improving all of the angles that have been said earlier. So we therefore call for concerted efforts and commitment from all stakeholders in order to ensure implementation of patient-centered care in women's health. Let's change the narrative and save more women's lives. Thank you very much for your attention.
Thank you so much. Thank you so much, Dr. Benedict Ekaidem. That was a